Dr. Kevin Mangelson with the Center for Sleep Apnea and TMJ. I want to talk a little bit about a non-reducing disc displacement. There's some previous videos discussing a reducing disc displacement, but let's talk quickly about what happens when a disc might not go back into the right place, something we refer to as the non-reducing disc displacement or a locked jaw. So what happens, if you look at the previous video, some people will have this disc that goes out of place, and when they open, it pops back into the right place. Now some people, that progresses over time where they will open, pop into the right place. And when it does progress at times, this disc may slip further out of place and become stuck. So that when they go to open, they're actually unable to open because the ligaments and joint here is stuck and this disc will not return into a proper position. This is typically associated with pain. For many people, it progresses slowly over time, meaning my jaw popped and clicked for perhaps even years. And then one day, either I woke up or I ate something or there was some sort of event that happened that all of a sudden I can't open. People with a locked jaw may be able to open about 1 or possibly 2 fingers wide, but find a severe limit in how wide they can open. Often they'll find pain or discomfort right in front of the ear when trying to open, or a radiating pain that kind of radiates in other areas of the head. So what do we do about this? The first step would be to confirm that this is happening with an MRI. We get an MRI to be able to view this disc here and exactly where it is, and also the condition of the disc to show us, is the disc healthy? Is the disc looking like it's something that can be put back into place? After that MRI, we can do a simple procedure. We do an injection into this jaw joint and fill this joint with numbing and with fluid. What that does is provide a little hydraulic pressure so that then when we open, we get you to pop back in to the right place and realign this disc within the proper place in this joint. Now, if we sent you home without doing anything further for you, what would likely happen is you would go home and bite down on your teeth and this disc would slide out of place. So what we actually do as a part of that procedure, once we've gotten the disc back into place, is make a temporary splint, something to go in between the teeth that will stabilize that disc in the proper place. That way you can open and close and open and close and that disc is stabilized. That's typically something that a patient might need to wear for a few days in order to stabilize that. And then we can talk about long-term treatments and if you need a long-term stabilization or something like that. And that's the basics of a non-reducing disc displacement or a locked jaw. If you're having trouble with locked jaw or any other kind of temporomandibular joint or TMJ issue, please contact us at the Center for Sleep Apnea and TMJ so that we can help you get complete function back of your jaw joint and find you a happier, healthier way to live.